One of the most crucial parts of treating infertility is paying attention to sperm factor infertility. This is something that is often diagnosed. It's expected that approximately half of the couples or infertility cases that a healthcare provider would see are affected by sperm factor infertility. Yet, it's very rare that I would see patients who have been dealing with sperm factor infertility that have actually been given a solid treatment plan or guideline recommendations of what they should be trying and looking at to try and actually improve the sperm parameters. And this is very important. Sperm parameters for a lot of patients are actually quite fluid. They can go up, they can go down. So helping to facilitate an environment, a lifestyle that can help improve those sperm parameters can actually go a very long way in supporting couples that are dealing with infertility and attempting to try and conceive either with assisted reproductive technologies or even if they're trying to conceive naturally. So when we look at sperm factor infertility, there are several external variables that can actually have an impact on fertility and sperm health. And this could include, for example, environment. There are now some studies linking even seasonal correlations where they see lower sperm parameters in the summer, higher sperm parameters in the winter, potentially because of temperature fluctuations. Environmental exposure seem to have a strong link with sperm health and infertility as well. So exposure to certain air pollutants, contaminants, heavy metals, lifestyle as well, and a very important component is actually diet, which is a focus of what I would like to speak and converse about today. So a fertility-focused diet, there is no one type of diet out there that's been shown to have the best impact for fertility necessarily, but instead there's an overlap between different types of diets which seems to have a potential positive impact on sperm health and fertility and may improve chances of conception for those that are struggling to conceive. So with sperm factor infertility, I usually look at what I call a hybrid fertility diet. So it's actually a combination of a Mediterranean diet, an organic diet, and a low-carb diet. So the combination of these three diets together seems to actually have a very positive impact on supporting reproductive health parameters. So when we look at organics, it's basically referring to the type of pesticides, the amount of pesticides that we consume, and there is some limited research now suggesting that exposure to pesticides may be associated with reduced fertility or a longer time to pregnancy when you're trying to conceive. So consuming a diet that has a low pesticide content, I will often refer to the Dirty Dozen list. These are the 12 produce items that have the highest pesticide content from our produce. So if you're buying off of that list, it may be worthwhile considering to look at some organic alternatives. But in general, aiming for at least 80% of our produce being low pesticide or organic may be recommended for patients trying to conceive, and it's definitely part of the dietary changes that has now been suggested to potentially help improve sperm health as well. So trying to reduce pesticide exposure, consumption, and trying to include more organic foods, especially where it counts the most. You are having heavy amounts of the produce items from the Dirty Dozen list, which you can Google online, the Dirty Dozen 2023. That list is updated annually based on an environmental group here in North America, which will update the highest pesticide containing produce items from our grocery stores. The low carb diet actually has a very significant and potential impact, beneficial impact on sperm health as well. There is now some research linking a lower carb diet to improve sperm parameters, particularly reduced DNA fragmentation index, sperm DNA fragmentation index, which is very important because an elevated sperm DNA fragmentation index is now associated with reduced potentially fertility, may be associated with significantly higher miscarriage risk in those early few weeks of pregnancy as well. So reducing the DNA fragmentation index, we have a multifactorial assessment that we look at for patients on what could be causing the high DFI, and diet is one of those important components that seems to have a role. Having a lower carb diet may be reducing things like oxidative stress, maybe helping with insulin sensitivity. So there's potential mechanisms there by which they hypothesize why they see an improvement in sperm parameters just by reducing the total carbohydrate intake. The Mediterranean diet has a lot of heart health benefits, and there's plenty of research now out there looking at the Mediterranean diet for various health issues. And now we're seeing some potential benefits for patients that are struggling with infertility as well. So the four main takeaways that have been shown to potentially help with sperm health. Number one, eating more leafy greens and red fruits in particular. These are packed with antioxidants, polyphenols, carotenoids, and micronutrients that can help support sperm health and reduce oxidative stress. Number two is actually reducing the dairy consumption. So higher consumption of animal dairy may be harmful towards fertility for sperm health. So trying to include more alternative milks, plant-based milks, or reducing total dairy intake as well. Number three, grass-fed meats are usually recommended, aiming for those healthier lean meats, and grass-fed in particular may be beneficial over red meats and processed meats. Number four, it comes down to the healthy fats. So actually incorporating more avocado oils, olive oils, and nuts and seeds for their healthy fats have now been shown to be associated with improved fertility treatment outcomes and sperm health as well. For sperm health, incorporating these Mediterranean diet principles, a lower carb diet, and incorporating more organic produce has actually been shown to help improve testosterone levels and may actually help reduce that DNA fragmentation index for sperm cells as well. So if you are dealing with infertility, diet is one very important and often overlooked component of what can be done to actually help improve those parameters, but it should be part of a more comprehensive plan and not done just on its own. So you should always be checking with your healthcare provider about what a detailed and comprehensive plan would look like for you if you are dealing with infertility or sperm factor infertility in particular, and going over what type of dietary changes would actually be best for you.